This video describes the histological features of paradental cysts. As inflammatory odontogenic cysts, paradental cysts can actually appear identical to radicular cysts when viewed under the microscope. Clinically, however, the two have quite distinct presentations, since radicular cysts appear periapically on non-vital teeth, whereas paradental cysts present buccally, typically on vital lower first, second, or third molar teeth. So, paradental cysts can be underreported. And the reason is that they currently comprise 4% of all odontogenic cysts, but if inadequate information is put on the pathology form to allow a clinicopathologic correlation, they may well be signed out as radicular cysts instead. So it's important to ensure that adequate clinical history about the location and the vitality of the teeth is included. As for any cyst, it is typically an epithelial-lined cavity with a central lumen, and you can see the cyst lumen is fairly engorged on this slide here. Shortly, we'll look at this in a higher power view. Inflammatory cysts have particular features in the epithelial cyst lining and the connective tissue of the cyst wall, which help to distinguish them. In this case, the epithelium is hyperplastic, non-keratinized, stratified squamous epithelium, and there's some acute inflammatory cell infiltrate with spongiosis or edema, and this reflects the inflammatory classification of paradental cysts. The connective tissue stroma, which forms the surrounding cyst capsule, is an inflamed fibrous or fibrovascular connective tissue with chronic inflammatory cells like plasma cells or multinucleate giant cells. There's also other associated features which we saw on our biopsies, which can also present, like pulse granulomas, Rushton bodies, or particularly for radicular cysts, things like hemosiderin deposition or cholesterol clefting. Again, all of these features are signs of an inflammatory process. So now in higher power, looking at that cyst lumen, we can see that there's a lot of extravasation and also an inflammatory infiltrate there. There's been some bleeding in this lumen. The cyst lining is generally a thin, stratified squamous epithelium, but there are some focal areas of hyperplasia. There's no sign of any keratin, and there's small evidence of inflammatory infiltrate in the epithelium. It's much more pronounced, however, in the surrounding fibrovascular connective tissue that's forming the cyst wall. Now, in one of our biopsies, we saw a pulse granuloma. Pulse granuloma refers to a foreign body reaction. It's usually seen as its own entity in periapical areas or in the gingival sulcus, but it can present in inflammatory cysts, such as the paradental cyst, which is where we saw it here. Presumably, it's a reaction to food packing of plant or vegetable origin, so pulses, which is why it's called a pulse granuloma. Histologically, you can see in the circle there's a giant multinucleate giant cells, and there's a surrounding inflammatory reaction, and it presents as an eosinophilic hyaline mass. So again, this is lending towards the inflammatory nature of paradental cysts. Finally, we saw evidence of Rushton bodies. Rushton bodies are hyaline or eosinophilic glassy structures which can either appear curved or linear depending on how things are sectioned. Essentially, they are a flag that this is an odontogenic cyst. They occur frequently in inflammatory odontogenic cysts and are present in up to 10% of the cases. You can see one outlined there. Rushton bodies are normally seen in the epithelial component of the cyst wall and rarely in the surrounding connective tissues.